Orthobiologics is essentially two main groups of either stem cell augmentation or platelet augmentation that we use to enhance the body's own natural healing process, expedite healing, and improve the quality of the tissue that's repaired and healed at the end of the day. Leah is an extraordinary young athlete. She's an All-American cheerleader and was unfortunately devastated with a significant injury to her ankle. It involved a combination of ankle instability, a lot of scar tissue in her ankle joint, causing impingement, which is very painful in its own right. But coupled with that, she also had damage to the joint surface as well. We determined the best means that we could come up with would be to treat her condition arthroscopically, but augment it with this novel technology, orthobiologics, or in particular, concentrated bone marrow aspirate. Concentrated bone marrow aspirate is essentially where we harvest bone marrow from the patient's own pelvis bone. That sample is then spun down in a special medical centrifuge to obtain a high concentration of stem cells and growth factors. The stem cells that we utilize are the patient's own body stem cells. Within all our bones, we have mesenchymal stem cells which have the potential to differentiate into bone, cartilage, or other tissues within our system. We then proceeded with a standard ankle stabilization procedure along with a synthetic cartilage matrix to try and stimulate a more normal type of cartilage formation. Within 6 months of her surgery, Leah was back performing at her elite level of cheerleading. Certainly, I think part of the surgery is in credit to the work that we did for her, but there's no doubt that I believe part of Leah's recovery is also down to her own ability and dedication to her rehabilitation program. There's an exciting evolution which is ongoing, and here at Yale, we are right at the pinnacle of that.